Thank you. Okay, we move on to our first topic, which is coordination and support for flood and other hazard education and communication. I believe our speakers are online. David Middleton, Molly Ramsey, Justin Gordorf, and Charles Helbig. I'm going to turn it over to you.
Yeah, good morning. I just wanted to let you know Justin is not going to be able to attend today. He had a family emergency that kept him out most of the night, so unfortunately he will not be here. So I just wanted to give you that. So really the purpose of meeting from getting together is just to share information, and I'm going to kind of be winging this because he was going to do a lot of the talking and I'm kind of playing catch up. We all play a lot of different roles when emergencies happen in Garrett County. So, we just we know that the health department and emergency management both work on disasters in different ways, but there's a lot of ways that we can intersect both for flooding and for all hazards. And we just kind of wanted to go over some things. You can go ahead and go to the next slide, Mom. So, just another way, why are we here? We have a shared mission, protecting public health, safety, strengthening coordination, understanding information flow throughout the county. That's our main purpose for being here. Go ahead. So what does emergency management do? I don't know if everybody's familiar exactly what we do. Our primary role is, a lot of people think we take over an incident in an emergency. That is actually not what we do. What we do is coordinate all of the entities that are dealing with the emergency situation. So we help control the information flow, the supplies, the resources, things like that. We make sure that the right people have the right information at the right time is kind of what we do. And that it is, vetted information, accurate information, so that us and other decision makers can make those decisions appropriately. Go ahead. So, when are we involved? We're involved every day, all day. We have, even when there's not a major event happening, we're still monitoring, we adjust our activation at the Emergency Operations Center accordingly. We have 4 levels of activation. Normal, which is what we're in now, nothing major going on, but we're still monitoring everything. Enhanced, if the situation goes up a level, we will move up to enhanced. That's just our way of saying we're paying more attention to a certain thing that's going on. And that, we're starting to keep a real eye on something that might be happening. Above that would be partial activation. That's when we're bringing in certain community members, stakeholders, partners, things like that to help control a situation as it evolves. And then a full activation, we're bringing in almost all of our partners if necessary. We're fully activated the EOC 24/7 and until the situation is completely under control. So how do we make decisions at the Emergency Operations Center and in emergency management? The main thing to know is we do not rely on a single source. We rely on multiple sources, trusted sources. We get real-time updates. We get coordinated input from state level, federal level, and the local level. Just multiple sources, verified sources in real time. Okay. So on the operational side, some of our bigger sources, of course, National Weather Service, Garrett County, that's our biggest thing is the weather, floods, severe weather in the winter, high winds, things like that. Earth Networks Earth Networks is a paid weather service that we do that has some of the best radar around. It's a really good radar system. We can keep track of all of incoming storms as it approaches. Very good system. Maryland Department of Emergency Management. One of the things that they have is something called M-Dash, which you'll see me looking over here at it. Actually, it has an abundance of resources, and this is actually a public source. If anybody wanted to get on it, it's just if you go to Maryland Department of Emergency Management, they have a situational awareness page, and you can click on this. It has weather, traffic, power. It even has if the Walmarts are open or not in different areas. It has hospital alerts, whether a hospital is on a deferred, intake because of something that's happened at a hospital, like a power outage or a cybersecurity incident, fuel outages, things like that. Just all kinds of wonderful information that can be had on that website. I highly recommend going to that. And if anybody has any questions or anything throughout, you can just yell them out, or if you want this information at the end, I can always email you the links and everything as well. Any questions so far? All right, hearing none. Local resources. So there's a saying in emergency management that all disasters happen locally. The reason that is because the local responders are the first ones to know what's going on, the first ones to deal with it, and it escalates from that situation, but it's always local first. So our local fire, EMS, law enforcement, they're the first ones out on the scene. We gather information, they report back to us. You guys at the health department, if you have a situation going on, you would be reporting to us as far as, what you're seeing. 911, and I put trends. The reason I put that is it's not only single source calls. Like, yes, we do get one call that there's a car in a ditch somewhere. That happens. But trends through 911 also tell us a lot. If we get 20 calls about multiple vehicles in the ditches on the interstate, we know that there's a big problem overall, and then that's going to change how we respond to those kind of incidents. It's you just got to look at those trends. It'd be the same thing, I'm assuming, in the health department in your field. If you got one call of a infection or 50 calls of infection in a certain area, we just look at those trends and then go from there. Let's see here. So monitoring tools, we use all kinds of monitoring tools to get a big picture. This is just a small selection of them. MView, it's a website that we get on that has cameras, literally thousands of cameras throughout multiple states. We have them up and down 68. We have them throughout the county. We can gather weather information. If I'm out of the office and I'm working, let's say 3 counties away, I can still get on this MView and look at the cameras in our county and see in real time, is the snow laying, is ice forming, things like that. Is fog rolled in? That's just a good way for us to get situational awareness. The M-Dash I've already talked about. And then weather and infrastructure monitoring. That's our National Weather Service, our Outlook, or not Outlook, our Earth Networks. Mesonet is also a good one. Mesonet is a weather monitoring station. We actually have one in Bittinger at the 4-H camp. You can get online and look at real-time weather data for the county. That's a good place to look. Let's see what's next. So this is just kind of tells you how we go through an entire situation. We collect information right out the gate, and we verify that information is real and accurate. We analyze that information. After we analyze it, we decide, what do we need to do? Do we need to escalate to bringing in more resources? Are we okay with the resources we have? What do we need the public to do? What do we need our partners to do? Based on that, we share this information both internally with our partners and externally to the public as needed. So for our partners, there's multiple ways that we can share information. Emails, obviously, we can email all day long person anyway, but we'd email our partners any time of the day. They know what's going on. WebEOC is it's a web-based emergency operations center, basically, for the state. What that is it gives us access to not only state assets, but every other county in Maryland. If we need something, send out a request. Let's say, we need high water vehicles in a flood to help rescue people. We can send out an alert on WebEOC requesting that asset, and then other counties within the state can accept that and send that asset to us. Just another way that we can get information out there, and obviously calls and direct coordination with other partners. Next would be public. So sharing information with the public happens in multiple ways. Nowadays, social media is probably the best way that we get information out there. We have a Facebook page. We have multiple different ways we can put that out there. We send out information. We have a public information officer through the county that shares information also through our Facebook, through the county's Facebook, things like that. Everbridge is our alerting system. Everbridge and Citizen Connect is basically the same thing. It is it's a sign up system for the county where citizens can go to a website, sign up, and select what alerts they want to receive. You can get weather alerts, traffic alerts, all kinds of different things. It also allows us, in a true emergency, that we can push information back. So if you're signed up for this service, we would send out, let's say, a winter storm watch. So you would get that automatically. If it was a true event, like an imminent tornado, we can actually override that system and push it out whether you signed up for those alerts or not. So in a true emergency, we can make sure that anybody in a given area is getting that alert using that system. Website updates, that's like our county website, Garrett County government website, emergency management website. On that, we have updates on there as well, but it's not updated as often as our social media. Social media is just more user friendly and seen more. So during an incident, communication becomes more structured and frequent with everybody during an incident. We are giving situational awareness to our local partners. Information is coming in here. We're pushing out the facts that they need to make the decisions they need. We're doing briefings, either virtual, in person, whatever, depending on the situation, and coordinating calls with the partners that are involved, with the state if needed. Depends on how big the situation is. Let's see. So just for an example, if the National Weather Service issued a severe weather warning, we're going to look at that. We're going to see first off what it is. Is it just that we might get 4 inches of snow. Well, 4 inches of snow for Garrett County is not really much. That doesn't really impact us much. Is it a foot of snow? Okay, then that's going to change how we're going to look at things, change our alerting levels, possibly even change the EOC, Emergency Operations Center status to enhanced or partial, depending on what's coming. So we'll start looking at it. We'll start taking local reports, Public Works, Roads Division will alert us, okay, hey, we're seeing snow come in faster than we can remove it from the roads. All right, well, then we're going to verify that information, notify our partners, and notify the public that, hey, the road, we can't keep up with the roads. Snow's coming down too fast. You should probably stay at home. So that's just an example of how information flows through the EOC and how we report out based on that. So where do we intersect between EOC or Emergency Management and Health Department? Strong communication is vital here. We need two-way information sharing. I know I have somebody at the Health Department that I talk to frequently about what's going on. So I do have contacts there. We maintain information if there's something going on that we feel that each other needs to know about. Joint messaging, resource coordination if needed. I'm sure everybody unfortunately remembers COVID and all the resource coordination between Emergency Management and Health Department then. And public health awareness, we want to share the same messaging that you do, make sure it's appropriate, make sure it's identical. So there's no gaps in what we're sharing, what you're sharing, no discrepancies, things like that. Let's see what we got next.
So at this point, I was going to talk about this project that we've been working on. So Dave, I was going to start talking. Was there anything else you wanted to cover here, or do we?
No, not unless anybody has any questions so far.
Yeah. Are there any questions? Okay. There'll be time at the end. We've made sure to leave time at the end so we can discuss. So I wanted to share today and just thank you all for the time to talk with you all. So I'm working with Dave and Justin in my position as a watershed coordinator on the updated hazard mitigation plan and developing communication materials and strategies, and specifically focused on flood hazards. And this particular hazard is the focus. This is more of my background, but also as I was communicating with, we're working with the University of Maryland Global Campus graduate course in environmental management. They do a capstone course, so they work a bit like a consultancy. And so we talked about what are some of the needs around environmental management issues. And this was one of the big ones is talking about changing hazards and how to increase understanding, and also, with that updated hazard mitigation plan, what are some materials and tools that could be helpful for that education outreach piece for Garrett County. And so with this capstone course, there are multiple groups of students that kind of divide the need, and they develop different products. And so through this communication with emergency managers, helped identify what are the needs for communication about this particular hazard in Garrett County. And then worked with you all, the health department as well, and appreciate your assistance with this to develop some tools. And I'm going to go over some of those in a bit. And these include maps, flyers, and different strategies for how to share that information. And More recently, at the beginning of this year, we had a meeting with some of the health department folks and the emergency managers to continue that conversation. There are other ways that we can be coordinating and supporting one another, and specifically focused on this, increasing the Garrett County residents, but also the visitors who come to the county, about where to get information, how to understand what do they need to be paying attention to, what are some of the hazards that they might not be aware of, kind of just updating that information for folks. So I'm going to share some of the key takeaways from the discussion between the emergency managers and health department, and where we're going with this, but then also to share some of the materials from the students, because we'll be incorporating those that are very useful for these efforts. So first to begin is to talk about some of the outcomes from that meeting between the emergency managers and health department. Of course, there's this ongoing relationship and support that's already established, but specifically around hazard communication, and then we were talking about flood hazard, is some of the challenges for emergency management. One of the key goals is to get information to people early so that they can take appropriate actions. And so the Citizen Connect is seen as an excellent method for letting people know, we have a watch for a particular hazard. And in this case, if there's a risk of flooding, flash flooding, and this is something that you need to be on the lookout, be paying attention to weather reports and also local conditions, and be looking for additional information from us in the future. And another piece of that, something that we will be developing, is having an understanding of what one needs to do to prepare for a flood, if it's going to be affecting where you're driving that day or your home. And so the challenge, obviously, in this rural county with steep terrain and also remote communities, is a system like Citizen Connect, where we need to have good broadband and cell coverage, and that is an issue for parts of the county. And then there are populations that do not use the internet. They don't use internet tools as well, or they don't know how to use those tools. So that's, particularly the elderly folks areas, people who live in remote areas where they do not have broadband and cell coverage, and for example, the Amish population. And so this conversation between emergency managers and health department folks, who you all are in the community, in a very direct way and expansive way, helps identify some of these additional vulnerable populations, but also some of the best ways that you have found to communicate with them. And so that was part of, some of the results of this meeting. And another challenge in this hazard communication is reaching people who are coming to the county as visitors, so they're unfamiliar with flood risk areas. In addition to that is people who have lived here for a long time in the county, and so they assume, based on their experience, where there have been floods. But there are flood zone areas that maybe have not had an event in the last 100 years, but they could have an event because they are in a flood zone, but also with changing, more extreme weather conditions that are happening more frequently. Flash floods are becoming more of a risk. And so that unexpected area that is now vulnerable or becomes more of a risk area is something that we're wanting to communicate and make sure people are aware of. The other thing is understanding what is the difference between a watch and a warning. And so if someone does sign up for Citizen Connect, they understand, okay, so there's a tornado watch. What does that mean versus a tornado warning? When do I need to take immediate action versus a watch where I need to start preparing and start looking for that information? Another issue or challenge looking for methods to help with this is getting folks signed up for Citizen Connect, but also that how am I setting this up on my phone so that it works properly, so that I am getting the alert. There isn't like a security update and now I don't have that update information, or I'm just not super good at using my phone and technology, so now I don't know how to use that. So we want to make sure that people are who are signed up are able to use it well. And there's an additional piece of this meeting. We included the floodplain manager from the county who deals with the flood insurance rate maps and property owners who live in a flood zone. The challenge where people don't necessarily understand that they are in a flood zone, or understand that means that they need to be taking certain actions on their property, be expecting potential conditions, but also if they rebuild in that area, there are different requirements. There are different rebuilding requirements that they need to do through the county. And this is part of that education outreach that we'd like to develop and have disseminated. So I don't know if there's any key questions yet, but I'm going to move on to show some of the materials that the students have created this past semester. And to just say real quickly, there's another cohort of students this semester, and I'm going to be sharing the dates, and I will share invites for anyone who would like to attend those presentations, but I'll share more information about that in just a minute. So real quickly, I'm going to show one of the groups that created maps for residents and visitors to understand where are the areas in the county that are vulnerable to flooding. And the students did this in a variety of ways. They used the existing flood risk maps that have primarily to do with riverine flooding. And then they also worked with the emergency managers, Dave and Justin, to use their knowledge of where they are concerned about flooding, where they have seen and experienced flooding. And when they know there's a potential big rain event coming, they're looking at this particular area with concern and identifying where this might be an area where we're going to have additional flooding beyond that already mapped flood risk zone. And so the students worked with those Dave and Justin to create these LOFPAs, or locally observed flood prone areas. And so creating these digital maps, this will allow Dave and Justin to more quickly have this information ready. They can use these maps to then have a list with the addresses of all the residents that live in that area, and they'll more quickly be able to reach out to those folks to get that watch information or warning information or potential evacuation information to them more quickly. And they also reached out to many of you that are here today to understand some of what your experience and your knowledge working in the community with people's understanding of flood risk and how best to reach folks. And so that was really very beneficial, helpful information. And then also what your role is for a variety of hazards, what stage of the hazard event, and what are some of the resources that you're able to provide to the community members. And so again, they created these maps that showed extensive information about where there's flood vulnerability. And they identified the needs through conversations with all of you, the need for static maps that can be printed, that can either be distributed to people in the community for those folks who do not use technology or look online to see where flood risks are or flood vulnerable areas are. But also for the emergency managers can print out these very large maps and use them for planning for these events. And so again, these maps will be available for county residents and visitors, as well as emergency managers, and for you all if you would like. And you can see, I'm not sure how well you can see this, but I can share these, a legend that explains in more plain language terms what these flood zones mean. You know, what's a 1 in 100 year versus a 1 in 500 year flood risk area. And they created these keys, these little handouts that explain those. And then a QR code that will take them to that online map tool. And also Citizen Connect. So this is a way to encourage people to sign up for Citizen Connect to show that they will be able to get this flood risk information as well as access to these maps. And one of the really cool tools that they created was the story map. And so I'm sure many of you are familiar with these, but it's a way. And so I'm not going to open it up because it's a little tricky with this, but I will share this. Essentially, it shares a lot of information and it's very interactive. So you can click on a link within the story map online and it will take you to another resource. So in this case, it's they created these detailed flood risk maps for all of the different municipalities in the county, but also additional areas where residents live, visitors will go to in the county that are at risk of flooding. And so I'll share that link with you all so you can see it. But this will be, after it's been refined, available to the public in the future. And this Know Your Flood Risks is an example of, this could be a flyer, this could be a postcard, but that can be used to promote this tool, this resource. The students also, they created a variety of just general educational tools that can be distributed. This is a video that explains the difference between 1% probability of flooding or 1 in 100 year floods, and gets people to be thinking about the different types of floods, flash floods versus, like a more conventional or typical riverine flood event. And as you can see, that again, it gives you that what you need to do and to be aware of what you need to do if there is a flash flood watch or a flash flood warning. And so part of that is wanting people to be understanding where the flood vulnerable areas are in the county so they avoid those. Of course, those will be in the alerts, but just to be building on that information, that education of folks. Here's another example that is a postcard. This is the front and the back of a postcard that's based on another one that's been made in Maryland, but it talks about what is the difference between a watch and a warning. And then it shows a turkey dinner as an example to understand we have the ingredients for a turkey dinner. So we have a watch, we have the ingredients, we have the potential for a flood, but we haven't moved into the actual flood event or more imminent probability that we're going to have a flood, which is when we have a warning or we actually are sitting down and having the turkey dinner. So that's an example. And here's another flyer about flash floods, the very simple but clear directions of turn around, don't drown if you see floodwaters on a road. And this is an example that shows, specifically for Kitzmiller, this is targeting visitors. So as you can see, we want you to explore Garrett County as well as folks who live in Kitzmiller to sign up for Citizen Connect. And this brings up, I'll just mention it briefly, developing a special Citizen Connect system for visitors. So it's like a temporary system for them. But that they will be able to use that. And understanding that there are limits to how Citizen Connect can be used in the community for those folks who do not use technology or do not have access to the internet or the ability to use technology. And so what are some other methods to make sure that information is being reached? And so one thing is, you know, that social network where you make an effort to develop that if there isn't one already. If that's either with family members and friends or in your immediate local community. And so one example is the phone tree. And as part of this preparation educational campaign is a little card that people can use to help them develop that network, have that information handy, so that if there is a person in their network, and this is the idea, that has access to Citizen Connect, is using those alerts, then they can be calling people up, sharing that information, and therefore reaching these vulnerable populations. So this semester, the 3 groups are doing somewhat similar projects, but expanding this. One group is focusing on that preparation phase. So a household developing your hazard preparation plan. What is our network? Who are we contacting in our daily life? Where are we going within the county? Where are the flood risks in that perimeter of our day? And what do we need to do on our property or where we live? If it's an apartment, to make sure that things are more flood resilient. And another group is doing lessons learned. So they've been interviewing emergency managers and other folks in Asheville, North Carolina, to learn particularly about communication, emergency communication during that event, what they are now instituting in Asheville. The other is a flood-related vulnerability index, and this is going to be another online spatial tool that one of the maps is specifically looking at one-way out roads. We need to understand where those are because they can be to make sure that that's included in the flood risk understanding, because they can be cut off, and that will be part of that emergency response. Areas where there's more likely that folks will have one car or no car, and so transportation will be an issue. I think this is going to be a very valuable tool that might be relevant for some of the other programs that you all have with the health department. And so I'd like to make sure to share those with you. These presentations will be online next week, and I can send the links for each of them. Would love for you to attend if you're able to for any of these projects that are of special interest. So continuing on, in our conversation, our recent discussion between emergency management and health department, we identified ways that the health department can support emergency management. So one of the key ways is your extensive communication list, your email list. And so to help promote and to share information about the Citizen Connect system, why someone would want to sign up for that and how to sign up for that. And the health department's suggestion of these are some of the methods that we know work with folks who do not have cell broadband coverage, or they do not use technology like that. So you all had suggested that radio is an excellent way to be sharing this information, direct mailings, and some of your programs which can be used as outreach channels for sharing some of this information, like your home health programs, etc. And so we'll talk more about that in the future, but how to share information about the alert system, but also educating folks, sharing some of these materials about different types of flooding, what's a flood watch, what's a flood warning, and what we need to do to prepare. You all provided great insight on some of these vulnerable populations in addition to how to reach them. So that's just some of them. just looking at the time, and I want to make sure we don't go over. So, and then emergency management support to health department. It's getting you all signed up for Citizen Connect for those weather alerts, making sure that everyone has that information. And the other is situational awareness for health response and planning. These are some things that are already in place through the staff that you have that are already working with emergency management, but it was just kind of talking a little bit more about those and coordination before the event. Are there ways that emergency management can help with that as well? Again, so I don't want to go over, but this is my last slide, is we talked about potentially having additional seasonal coordination meetings, knowing that there'll be particular hazards that are more of an issue for different seasons, and sharing communication materials across agencies, particularly what is being developed right now, and developing clear public-facing information where I feel like you all have a lot of expertise in effective communication with a variety of populations, and so assisting us with that. So I'm going to stop here. Are there any questions? No.
Hi, it's Laura Robinson here. Are there opportunities for citizens to sign up to be like on a workforce? Should there be an emergency, that kind of thing? Do you know what?
So not directly with us. There
Okay.
is, that would be more through a Red Cross or we are partners with Maryland VOAD, which is volunteer organizations active in a disaster. If you go on the MD VOAD website, it lists probably 30, 40 different agencies throughout the state. A lot of them are church organizations, businesses, big companies like LifeStraw, things like that, that will accept volunteers. And then if a disaster strikes, we go through them to get the volunteers organized. We don't organize them directly, frankly, because we do not have the bandwidth of people to organize that.
Right. Okay.
So we rely on them for that.
That's helpful. Thank you.
Yep, absolutely. Marion?
Yeah, I was thinking along a similar line with Laura. Even if you don't have the capacity or ability to establish that linkage and work with the volunteers, part of your communications planning might be educating a group of those volunteers, unless that's already part of your plan, to get in sort of citizen leaders from some of the groups to tell them what you're telling us about the resources that are available so that they can carry your message to broader groups of the public. Just a thought.
Yeah, that's a good idea. I know one thing we're trying to do, and we have not done a good job of it, but we're trying to get out to every municipality and talk to the local governments in the municipalities, local boards or whatever, and we could pass that information along to them, and they could get it out to the citizens of their municipality, and that would be a good way, to get them to sign up and to know that exists. So that's a good idea.
And that similarly is trainings for rental and property companies. That was something that Dave and Justin, you all wanted to do, and that's one of the strategies, but also through the chamber, identifying businesses that would be willing to do that, who interact more with visitors and can help share resources, but so on top of what you're talking about, like volunteers, what they can do in an event.
Yep. Yeah, go ahead.
Yeah, you talked about alerting the population of flood possibilities, warnings. Can you talk a little bit about activation of shelters when that happens, so people know where to go, and how do you know where they are? How fast can they get operational in those type of emergency situations?
Yeah, so we have in the county we call it a freezing and inclement weather plan, but it's also kind of our sheltering plan. We have pre-established shelters, most of which are your fire departments, local fire departments. We also work with Department of Social Services. It depends on the situation. For actual shelters, we normally don't open what we would call an official shelter until we get about 12 or more people. Up until that point, we kind of take care of it on an individual basis, something like get them a hotel room or ensure that we can get them to family, something like that. If it gets above and beyond that 12-person space, then we'll open up a shelter at a local fire department. Or, we have the Garrett College. Garrett College can help us out with that. It's an official state shelter. As far as getting that information to the people, we can issue that through Everbridge Alert. We can send it out through social media, radio stations, local fire departments, and it depends on the situation. Like the flooding we had last May, we had fire departments going door to door with EMS crews and basically boat rescuing people. And of course, we can give the information firsthand as we go through. So we have multiple ways to get that information out to people.
Yeah, I don't think it's a problem with people that live here all the time. They pretty much know where to go. They have family that are outside of the flood zones, whatever, that they can evacuate to. But I'm just wondering about people that are transient visitors to Garrett County. If they're in a certain area, how do you get information to them, and how do you activate a shelter quickly so that they know, okay, I got to get out of here. Where am I going to go?
Yeah, that's one of the biggest problems is people coming through, they don't know the area, they don't know where to get their information. That's kind of part of what we're doing with this project is we're working with rental agencies, your Airbnbs, your things like that. We're working with Parks and Rec for for state parks, campsite areas. What we're going to try to do is get a temporary QR code that we can put in all of these establishments. And what that would do is whenever somebody is there, they could scan that QR code as soon as they get there, and that would automatically sign them up for alerts, warnings, and information for a week. So it would put them in the system all week long. They would get any alert. And then at the end of that week, it would take them out. That way they're not constantly getting our information when they're not here, but it would also get them in the system when we need them there. Now, like I said before, if it's a true emergency and we have to push out extreme information, just them being in the area with their cell phone, we can override their phone and send that to them regardless if it is a true emergency. But it's that early warning, watch warning time that they're not going to get that information if they're not signed up.
What percent of the county is signed up for that? Those alerts. I mean, and what percent of the residents in Garrett County have actually reached out and signed up?
Honestly, I don't off the top of my head. I'd have to look. I know it's probably around. We have probably 20,000 people signed up for it, I think, if I'm not mistaken. But I don't know how many of them are actual county residents versus some surrounding counties, some people that's been here before, moved away, passed away. So I don't know I'd have to look to see what an actual, as of today, percentage would be. I'm not real sure.
Okay. Thanks.
Yep. All right. If there's no more questions, Molly, that's all I have.
Me too. So I made a note of a couple of things that we can share with you all, including some of those links you were talking about, Dave, about weather and hazard, and also the Citizen Connect. And then I'll share links for those presentations next week from the students if folks are interested. Thank you all.
Thank you.
Thank you all. Great information. Our next speaker is John Corbin, and he's going to talk about the University of Washington's Health Risk Study.
Okay, well, first off, I also just want to go ahead and thank Molly and Dave and the rest of the team. They've been fantastic partners to work with as we continue to look at, those 3 Ps, right? Like you're used to the health department, like presentations where we're like protect, prevent, promote, right? Or 10 essential services we do at the health department. And this is a huge piece of it. Really thinking about like how this plays a role in what we do across services, because this can really affect pretty much all of our operations, depending on the emergency, depending on the risk or hazard that's present. So I just want to thank you both. That's been fantastic. I am looking forward to at least trying to make some of those presentations. These have been really fantastic. The work that the students are doing is really impactful. And it's a great piece also to kind of tie into what I'm going to talk about next here. So one of the things that we've been doing over the last couple of years is trying to think of more ways that we can sort of approach an academic health department status. And I know what you're thinking. Why would we want more work, right? Like John already sends out emails every single day. You hear from the health department constantly. There's just constantly stuff happening here. So why would we want to do more? But the reasons are the same reasons we just talked about. These are things that we want to pay attention to. We want to learn from. We want to get better across the board at the different ways that we mitigate different types of hazards and the ways that we can create larger impact with the programs that we do have and sort of figure out what's next, right? So one of the things that we've been doing as part of that is for many years is workforce development. So the health department is a huge site. We have all kinds of different types of interns that come. We do all kinds of different work with sort of thinking about this workforce development pipeline, how we get folks in case anybody's interested in a job. We have many posted usually. And as you know, we do have a health professional shortage area in Garrett County across several different domains. So that's one piece of what we've been doing. In addition, I just submitted my manuscript last night for some of the research that I have been doing in Garrett County over the past 2 years. So I hope to be able to share that with you in the future. But one of the other things that we've been looking at doing is looking at different opportunities to engage in sort of an academic sense, to get access to new tools, new resources, things that we would normally have to pay a lot of money for, and how we can continue to be better stewards of the funds that we have and just utilize resources that are available. So one of the things I'm going to share this morning, and the other thing I want to mention too, in terms of volunteer opportunities, sorry, it's the next tab. Volunteer opportunities is Maryland Responds. So if you all remember during COVID, I think most of the people in this room have had a turn working with Maryland Responds, but it's a really good opportunity as well. If you have free time and you're engaged, there's different things that you can sign up for depending on if you're just a community member, if you have different types of licensure, and that is something that does get used. It was used during the COVID-19 pandemic. But there's also other opportunities to use and engage that list as well. So that information is available on our website if you type into the search bar Maryland Responds. And then we also have Lori Peck, who is our emergency preparedness planner. Is that right? Yeah, a lot of words, right? So that is a good resource as well. But today I want to talk a little bit about this study. This is something that we signed up for the health department. And this was a nice to have, right? Like this is just more work that we're doing because we want to try to get a little bit better at some of these things. And this particular study is about heat risk. And I know what you're thinking, John, it was snowing this week. We need to be thinking about cold weather risk. And unfortunately, there are no fun free studies that we can do with cold weather risk at the moment that I was able to sign up for. But we were able to sign up for this. And one of the reasons that I think that this is a really nice piece is it also fits together with some of the work that we've been doing with folks at the county, emergency services, thinking about flooding, thinking about heat, as Rodney mentioned, cold weather shelters, some of those persistent things that we really deal with in Garrett County that are a little bit different than some of the rest of the state. But this is also a really interesting piece. So for those who don't know, probably about 2 or 3 years ago, we shared some of the updates from the Maryland State Heat Risk Plan. It was a new plan that came into effect. It set a lot of thresholds for when different services are available to different counties, what type of things that you can tap into. And one of the problems that we have in Garrett County is that we often don't hit the temperature thresholds, right? So we know that there are some times during the summer where it gets a little too hot, right? And we need to be thinking about particularly our older and vulnerable populations. We need to be thinking about how we engage some of the same things we were just talking about with flood risk and our home health patients and other areas as well. But heat risk is really one of those areas that it's a short window in Garrett County, but it is an important window to think about. And we have the opportunity through this study to actually implement some of the things through this tool. It's basically, just go forth. They give us access to something that's normally data that we would have to pay for or have to have some sort of subscription to be able to access, which is really nice for us in Garrett County. But one of the things that I think is really interesting about this is it gives us kind of a chance to run through some different scenarios, but then to also think about how they might apply to other things like flood risk with this project, and also things like cold weather risks. And one of the nice things about this tool that's kind of giving us some ideas of how we might move forward is basically it's all designed as choropleths, which is just a fancy way of saying shapes with colors. So as opposed to maps with points on them, which is also a really cool thing that the health department is doing. If you saw Melinda's presentation probably about a year ago too, they're doing some great things in environmental health. Also with the county, with some maps and some spatial data. But it's a really good way to look at, where risk is distributed throughout our county, and to think about this as well. So there's a lot of tools on this page, but my big ask today is there's obviously too much information to go through all of this today. We're not going to do a full research study in Health Planning Council, so everybody can breathe a sigh of relief. But I really wanted to just kind of present this and see if there's any interest. If anybody wants to participate in this, be involved in some of this planning efforts, because that's a big thing. Shelley and I do a lot of planning. That's what our unit used to be called, planning, trying to figure out how we do some of these pieces. But there's some neat tools in here that I think give us a different piece. And this also will help us kind of think about some of our grant development, how we sort of build and sustain more of these partnerships, and really think about not just those core public health services, but what are the gaps, right? Like what are the areas that we know that we still need some pieces. And one of the things that I really like about this that is giving us a lot of ideas for how we might approach other things from a planning perspective is that there's really robust methodology. So one of the things that's happened over the last couple of years is, particularly in our state grants, there has been a lot of movement toward really trying to enforce evidence-based standards and practices. And one of the things that this tool does really well is that it has very, very robust evidence-based practices. Thanks, Dave. And some of the methodology that goes with it is much more substantial. So as we start thinking about things that were presented in previous meetings, like the AHEAD model, Martin gave us a really great presentation on that, as well as the state health improvement plan, for anybody who remembers the last time that we went through that. The new cycle just kind of started not too long ago for that either. But this aligns really nicely, and it has good methodology that helps us really understand how this applies in Garrett County, because that's often a challenge for us. I know in previous years we talked about things like child maltreatment, where there's just a lot of mystery in the data. Like, what does it really mean? And one of the things that this tool does well is that it actually has really comprehensive explanations within the methodology, and then it also links to studies that prove that these strategies work, which is a really cool piece for us to kind of use as a jumping off point if we decide to focus on heat risk, or the flip of that, being cold weather risk, if we want to try to do some grant development around that, or just think about these things in slightly different ways. And another thing that I think is really interesting, if you remember when we started the planning tool, like think back 9 years, right? There's these little things in there in some of these groups that ask you to rate your strategies, right? Like they're either programs or systems, and thinking about, are these expensive? Do they have a high benefit? So we ask those questions. We've not done a whole lot with that data, but this is a really cool example of how every single sort of jurisdiction that you click into has different levels of recommendations. And I think that that's also a lesson that we're going to learn from this and kind of take back to some of our work. So as you flip down through this, you can see that some of these strategies are only moderately recommended. So indoor cooling, there's a lot of things that go into this, but you can then click into some of the methodology and see, like, for example, if electricity costs are really high, obviously ACs might not be the most recommended strategy for your area. So if you continue to go down, you can see, okay, well, maybe electric fans are more recommended for all of Garrett County. And the nice thing about this data as well is that it's available in the census tract level so that we can then kind of further scale down. So if you remember, when we go through and do the community health needs assessment, it's like map city, right? Like it's just like so much fun. And, you know, I just talk and everybody's like, yep, cool maps. Yep, let's do that. But this is a really nice way, I think, of being able to visualize some of this to see how effective it is, how easy it is to implement, and then what are sort of these long-term impacts and benefits, right? So like, what are strategies that have an immediate impact, and what are sort of these long-term infrastructure pieces? And thinking about infrastructure not always as, you know, huge physical buildings. Like maybe it might just be some program, like, you know, distributing fans or distributing a service, or thinking about green space in a different way. But this is a tool that we have access to. We are engaged in this study for a couple more months. So I wanted to kind of throw it out there. It, you know, didn't really feel like the right time because we've been in, you know, winter. So it's hard to think about heat risk in Garrett County when it's snowing outside. But I wanted to kind of throw this out for the last couple of months of the study to see if there's anybody who's interested at any agency, any organization, any of the folks that volunteer online or have any other affiliation, just in participating in this as we start to think about some of these particularly heat risks for this study, but also what the applications of this might be in our county. And if there's opportunities for us to think about some of these other challenges that we face. Because for me, this stood out because heat risk is sort of one of those areas where we don't fit with the rest of the state. Like that plan really is, you know, based on places that are warmer. But that's not to say that, you know, 78 degrees in Garrett County doesn't feel oppressively hot, particularly for some of our vulnerable populations. So like I said, I'm not going to go into all of it, but we can actually then click into census tracts as you can see some of those boundaries. And then for every single intervention that is mentioned here, you can actually go in and see all of the research that has been done, whether it was done on a rural level, on an urban level, and really get a better perspective of like where we might be able to go with some of these things. So like I said, we're learning a lot from this. I just kind of wanted to present this as a jumping off point and let you know that it's happening. But if anyone is interested in participating in this, it's a really low commitment. We're not committing to doing anything other than just thinking about how this might sort of work into some of the planning work that we do in the county. But also thinking about, are there interventions that could feasibly be done? And should we start thinking about those? And like I said, it's also nice to be able to kind of look at this and think about, you know, where we fit within heat risk, but also the cold weather risk, because that is, you know, the long-standing thing that we talk about pretty much on an annual basis at Health Planning Council. So I'm going to stop screen sharing. Does anybody have any questions, or does anybody like, hey, I want to volunteer, I want to work on this? Speaking of which, Ollie.
John, this is an excellent tool, and I'm assuming you could do this for flood risk, but maybe not. But it just looks like it would work really well. But when you were mentioning green space, that would just be excellent to look at that in terms of how green space can mitigate heat risk, but also flood risk. And so I see lots of opportunities for collaboration and work on that.
I love that, Molly. I think we should definitely connect on that.
Okay.
Does anybody else want to join our party? Okay, too. I know it was snowing this week while I was thinking about presenting this. You have my email address because you get emails from us pretty much every day. So if you're ever interested in participating in that, or like I said, if you want any information about Maryland Responds, you can reach out to us. And you know, just thinking about all of these topics we've talked about today, I think it's just fantastic that we have these collaborations across different agencies in our community, and it really just speaks to how well we work together here in county. So thank you all for your time, and I'm going to turn it back over to Tom.
Thank you, John. We're to agency updates, and we'll start in the room.
Okay. My name is Renee Stonebreaker. I wanted to come to the meeting in person today to introduce myself. You might have seen me online the past few meetings. but I am the new community health extender for the WVU Cancer Institute out of Morgantown. Okay. I actually am from Preston County, so I'm right across the county line where Maryland, Pennsylvania, and West Virginia come together. Not too far from here, right? But I have 11 counties. It includes the entire eastern panhandle of West Virginia, Tucker and Preston County, and Garrett County, Maryland. So that's why I'm here today, because you're included in my region. Some of the things that I do as a community health extender would be showing up to community events. I attended the Garrett County Health Fair a few weekends ago, was there, but also doing presentations, maybe at senior centers, things like that, be out and about, promoting cancer screenings and prevention. That's the department that I'm with at the Cancer Institute, is the Department of Cancer Prevention and Control. And also, if there are any community needs in relation to cancer that you might see or hear that are coming up frequently in the county, please reach out and let me know. We work with, there's a lot of people who do research in our department, so I can go back and say, hey, this is what I'm seeing out in the community, and they may develop studies for that community need. So I have business cards if anybody's interested in them, but please reach out. Anything and everything related to cancer, and if I can't help you, I can find someone who can. Thank you.
I have several things. May is Mental Health Awareness Month, and we're going to be celebrating here at the Health Department. Jennifer is going to light it up green here at the Health Department, and we're going to encourage other businesses and agencies to do that during the month of May. We will be doing a proclamation at the commissioner's office, and the commissioners usually wear green for that. That's going to be on May 4th. It's going to be for Children's Mental Health Week and Mental Health Awareness Month. And we've partnered with Lighthouse. There will be the 3rd annual Color Run Walk, and that will be May 16th from 1 until 4 at the Glades Park Pavilion. We encourage everybody to come out for that. It's a great family event. There's going to be bounce houses there, food there, fun, fun, fun. And if you want to walk and not get color on you, we can accommodate that as well. And the other thing that I have is the health department, the local behavioral health department is sponsoring a crisis intervention team training on May 18th through May 22nd. Registration is still open till May 1st for that. If anybody has any questions, they can contact me. My name is Sadie Liller. And then the last thing that I have is Community Action. We'll be having a community resource day on Friday, May 29th from 10 to 2 p.m. And that's at Glades Park Pavilion as well. They'll be doing haircuts, giving out hygiene kits. And I remember from last year, it was pretty well attended.
So on May 11th, we just finalized it this morning. May 11th, we'll be reopening our Grantsville Center. So we'll be having a grand reopening that day and ribbon cutting with the Chamber of Commerce. So if anyone wants to attend that, we're pretty excited about reopening Mount Laurel, and we in Mount Laurel switch buildings. We'll be reopening.
So Shelley is actually on the road today in regard to 360 Access Hub, continuing to figure out our next steps with how that continues to grow in our community. But I really just want to thank everybody who has been participating in that endeavor with us, but also to open and extend a call for volunteers. We really do need more volunteers. The program continues to grow month after month. This month, for the month of April, we served 124 families in Garrett County. And that was just a monumental undertaking. So I want to thank everybody who participates in that and helps us do that. But it is absolutely a service that we do need volunteers to run at that level. And because it continues to grow every single month, that is a huge piece. But it's just some of the most rewarding work. So I encourage anybody who hasn't had a chance to come and participate in that to do it, because at the end of the day, you feel so exhausted that you just want to sit down and not stand back up, but you're just so happy that you almost want to cry. because there's just very few things that we do. I know I come and I talk a lot about like all of these super fun nerdy things that I'm really into at Health Planning Council, but that is just such meaningful work that really goes back into our community and serving families here. So anybody who's interested, you can reach out to me or go on the 360accesshub.com website, and you can find out more information about volunteering.
Commissioner?
Hi, everyone. My name's Kirsten Nesselrod. I'm the resource director with Hospice of Garrett County. Just a few things. So we are having our walk for hospice. It's the 31st walk that we've had. That will be happening on June 20th at the Grantsville Town Park again this year. So Grantsville had us there last year, and we're going to be there again this year. We had a really nice turnout. The registration will begin at 10 a.m. and then the walk will start at 11 a.m. And then we also are doing a volunteer open house. We're having one in McHenry and one in Oakland. I'm trying to find, I can't remember the exact dates, but those are coming up. It's on our Facebook. We're trying to recruit more volunteers for our hospice patients. So if anyone's interested in that or getting more information about that, they can reach out to myself, or you can reach out to the hospice office as well. Thank you.
Others online? Anything to share? So we are to the point where we're going to adjourn the meeting today, and thank you all for attending. The next meeting will be May 28th, which is actually the Garrett County Board of Health meeting. Share that day. Thank you, and see you then.